Hello, my name is Nancy Wolfe. My topic for discussion today is nurse-to-physician communication using an Sbar tool. I am a clinical instructor for fourth semester nursing students at a community college in Southern California. Nursing students graduate with little nurse-to-physician communication interaction. Even though nursing students cannot accept physician telephone orders, effective communication with physicians is an expectation of a new graduate nurse employed in a hospital. Imagine a new graduate placing a 3 a.m. call to a physician regarding a patient whose condition is deteriorating. The result of this communication interaction may be a positive one. On the other hand, it may be a negative experience for any of the involved parties, the nurse, the physician, or the patient. Why is communication so important? The BSN Essentials state that effective communication and collaboration among health professionals is necessary for improving patient health outcomes. Mandates set forth in the California Code of Regulations, Title 16, support integration of communication skills, including principles of verbal, written, and group communication in order for a nursing program to maintain accreditation. These regulations are incorporated into the student learning objectives for nursing courses. The National League for Nursing directs nursing students to think critically and communicate effectively. Effective communication is a critical element in patient safety and quality of care. Indeed, according to the Joint Commission, communication was the root cause of more than 60% of sentinel events in 2006. As a result, improving staff communication is on the 2010 Hospital National Patient Safety Goal List. Communication between caregivers is difficult due to many barriers. For example, nurses are trained to be very descriptive and detailed. On the other hand, doctors are trained to be brief and to the point. A lack of reporting structure leads to missing essential aspects of the message. Background noise increases stress. Sometimes nurses' stations are as noisy as a freight train speeding down the track. Sometimes there's so much activity in a nurse's station, you think you're in Grand Central Station in New York. Or in Los Angeles at the Los Angeles Union Passenger Terminal. Time constraints often limit the ability to ask questions. The characteristics of effective communication include the active practice of delivery and receipt of information. The exchange is closed-loop, collaborative, and with interaction. Effective communication establishes an expected pattern and allows for clarification and questions. The Sbar communication tool is a formalized method of communicating information between members of the healthcare team. The tool originated from the U.S. Navy acronym. The same tool was refined by the aviation industry. The tool was introduced to hospitals by Kaiser Permanente. The acronym stands for Situation, Background, Assessment, and Recommendation. So back to that 3 a.m. phone call. Before picking up that phone, make sure that you have your ducks lined up. S is for situation. What is the problem? Assess the patient and gather the medical record data. Next is B for background. What information is relevant? Include the date of admission, diagnosis, and a summary of the medical history and current plan of care. Third is assessment. Inform the physician of the results of your assessment. And finally, R is recommendation. What do you want to happen, and when do you want it to occur? When the physician gives you phone orders, write the telephone orders directly in the medical record and read them back to the physician. According to nursing theorist Patricia Benner, beginners have no experience with situations in which they are expected to perform. They learn context-free rules to apply universally. Using the Sbar tool empowers students by providing a tool to communicate with members of the healthcare team in a concise and organized fashion. Role-playing using case scenarios provides nursing students the opportunity to practice effective communication skills. Here is a list of my references. Thank you for watching my photo story.